Hello and welcome to today's episode of Focus Atlanta. I am your host, Keisha Lancelin. Thanks so much for tuning in with us this Sunday morning. February was National Heart Month. We'll discuss the most common heart disease risk factors. The Cars.com Best of Awards give us insight on how to make better purchases. And Girl Plus Environment will give us tips on how to implement policy. We'll begin discussing the shortage of healthcare workers. I'm here with Steve Beard. Thank you so much for making time for us here in Atlanta.
Happy to do it.
Well, let's start off at the beginning. What does research show about how the status is changing for healthcare workers?
Sure. So we released a piece today called the Covista Care Capacity Monitor. It's a comprehensive piece of research that surveyed over 1,300 clinicians and over 150 healthcare leaders, and it brings some important nuances to the long-running debate about healthcare workforce shortages. The big takeaway is that we go into 2026 with a healthcare system that's massively understaffed. 3 in 4 clinicians say that staffing shortages prevent them from delivering quality care, and about half of all hospital leaders have already reduced patient capacity. And that's at a time where we as Americans rely on that system more than ever.
Absolutely. Well, do we have reasons behind the shortage? What do we believe is the reason?
Well, we've got a large and growing asymmetry between supply and demand. We've got a demographic trend in the United States where we've got an aging population. The baby boom generation is moving into retirement. They will increasingly rely on U.S. healthcare to keep them healthy and vital. At the same time, the traditional pipelines that create healthcare clinicians in higher education haven't grown to meet that demand. So you've got a population in greater need of that kind of support, and we're just not producing enough clinicians at a fast enough pace to meet that demand. So those are the two root causes in our view.
At this point, have any idea or has your research shown how this is affecting patient care?
Yeah, that's probably the most profound takeaway from the work we've done. This is not a staffing issue. This is not a personnel issue. This is a care quality issue. And what we know is that both leaders of hospitals and clinicians at the bedside believe that they're not able to deliver the kind of care that patients deserve because of these staffing shortages. And so at Covista, one of the things we're focused on is thinking about how we can continue to scale up our institutions, which already collectively represent the largest healthcare educator in the country, to provide more day one ready clinicians to U.S. healthcare. We're also closely monitoring what's happening in technology, AI in particular, and the potential for those innovations to really relieve clinicians of some of the time-consuming administrative tasks that then will provide more time for them to care for actual patients. So we think those two dynamics could be part of the solution, and we look forward to playing a larger role in that solution and being a more active voice on the topic.
Thank you so much for your time. Is there any way that we could learn more or continue to get more information? Where should we look?
Of course, Covista.com, it's our website. You can find the full research on our site with all of the data behind it. In addition, you can find out information about our 5 institutions and the programs that we take to market in medicine, nursing, the behavioral sciences, and veterinary medicine.
Steve, thanks so much for your time. It was a pleasure to meet you.
Well, the pleasure's mine. Thank you.
Absolutely. All right. It seems like a daunting issue, right? When we think about the care that we get from our healthcare workers and providers, we don't always think about what those numbers look like in terms of getting them in these positions. Please take the opportunity to go to the website and learn more. And stay tuned to more Focus Atlanta. We'll be right back.